for one more round and a six-pack to go. Tomorrow morning, Sunday, I'm gonna be feeling low. So please, bartender, I want a six-pack to go. Hi, this is Mark Rabonic, and welcome back to the garage after a little bit of a hiatus. Last 6 weeks or so, I've been on the road, traveling to see friends in Florida, Alabama, and then visiting our daughter and son-in-law in Pittsburgh. Went out there with some friends to see the St. Louis Cardinals and Pittsburgh Pirates play. So anyway, I'm back in the garage, and the topic today is that over the last weekend, playing with a golf friend, we started to discuss when he was in graduate school for engineering in Sweden. And we started talking about, the social welfare system within Sweden. And one of the big mistakes that people make, considering Sweden and actually even a lot of the countries in Europe, is that and I use this term too, and I was wrong for doing it, is to call them socialist countries. Well, they're not really socialist countries because the government is not directing the means of productions. They're not directing how resources are necessarily being used. However, they are big social welfare states because you have the government paying for, and when I say the government, it's actually the taxpayers, that are paying for things such as health care, education, and even child care. And so if you want to take a look, Sweden has a really interesting history. It was a very rich country, and then in 1970s, somewhere in the 1970s, they decided to turn to socialism, and perhaps what you would call the full-blown socialism, where the government took over industries. Fortunately for the Swedes, they're a little smarter than the Venezuelans, and they realized in a short period of time that the promises of socialism were actually leading to a decline in living standards, and they quickly reversed course. And so a lot of those industries that became nationalized became privatized, but they still had the remnants of a large social welfare state. So we hear from the left today in this country about, free health care, free education, free child care. You're seeing it on the campaign trail, specifically from people like Elizabeth Warren, Bernie Sanders. And the problem is that, well, how do you pay for it? And I know recently in some interviews, Elizabeth Warren has been asked that question. Well, how much is the middle class going to have to pay for this? And she kind of toes around the answer and saying, oh, well, we're going to get big corporations to pay for it. We're going to get the rich to pay for it. But the fact of the matter is, if you take a look at Europe and the big social welfare states in Europe, it is not just corporations and the rich that are paying for these programs. As a matter of fact, it's the middle class that's getting hammered. So I have some beers here that I thought that I would use as an example. So I have a Miller Lite representing the United States. And then I have this really beautiful porter from Great Lakes Brewery. And I'll tell you what, one thing, we're coming on fall, it's porter season. And this is one of my top porters that I've tasted around the country. And I'm going to get a chance to taste some more as I travel. But anyway, so let's use the demonstration of this. So each one of these containers represents the median income in the United States. So the container of Miller Lite represents $60,000, which is the median income in the United States. And this porter represents the equivalent of $60,000 in Sweden. All right, so this free stuff actually comes, as we know, there's nothing free. As a matter of fact, I've always said that when people use the term free, they're actually showing somewhat of ignorance when they do so, because we know it has to be financed. And not only does it have to be financed, there are also economic or opportunity costs involved with it as we switch resources from other productive activities over to the free stuff. So anyway, the liquid in here is going to represent after-tax income. And by taxes, I'm talking about federal tax, payroll tax, state tax, local tax, and the same goes for Sweden. I'm not including sales tax or VAT tax into this illustration. So anyway, let's take a look. In the United States, a person making $60,000 is going to pay roughly around 23.5% of that in taxes. And so when we pour our net income out in the United States, it will look like this. And I apologize, I'm not using beer glasses today because I wanted to make sure that obviously that the container or the vessels were equal. So this is our after-tax income in the United States. Now, in Sweden, they pay roughly 50%. It ranges anywhere from 49 to 52%. So a person making the equivalent of $60,000 in Sweden is going to pay somewhere around $30,000 in taxes. And that's what, so this is what it looks like after they get done paying taxes. So this is what the United States has. That's what Sweden has. And so as you can see, a lot more beer in the United States than there is in Sweden. So how much do they pay? Well, if you take a look, there's approximately a difference of $17,000 a year that's paid in taxes between the two countries. And so over a lifetime, let's say of working 40 years, age 25 to 65, the difference in the two glasses comes out to about $680,000. So if we would multiply this out, and this was actually dollars being represented, the difference over the lifetime would be $680,000. But that's only part of the story because we have to take into account the opportunity cost of money. And so let's assume an interest rate of 5%. So the taxes that are paid in Sweden, those extra taxes, that extra $17,000 that Swedes pay in taxes, if we annuitize that out over 40 years at an interest rate of 5%, we find out that in opportunity, including the opportunity cost of money, the Swedes the difference is actually $2,053,000 difference between the two countries. Well, $2 million isn't exactly free. So the question that has to be asked is, well, when it comes to schooling, when it comes to education, when it comes to our medical costs, are the differences so great that paying all those taxes makes up for $2 million? And I have trouble believing that it does. And of course, the other thing is, though it doesn't take into account in Sweden, is the value-added tax. And that is a tax that's included in the price of their goods. So if you're ever in Europe, you know that you don't pay a sales tax at the register, that whatever that item is on the shelf, that's what you pay at the cash register because the VAT is already included. The value-added tax in Sweden can be as high as 25% or as low as 6%. And so for those that have been to Sweden, you know how expensive it is over there. They're beautiful countries, as one person put it, outrageously beautiful and outrageously expensive to go there. So the bottom line is that it's not going to be the rich and the corporations that are being squeezed. No, what's being squeezed is the middle class, and they're being squeezed like an orange to make orange juice. All right, so that's the illustration there. It's not free, and their after-tax income is quite a bit less. So when it comes to free healthcare, free healthcare also comes with an opportunity cost. And as we've seen in Canada, and we see in stories coming out of England, that opportunity cost is wait time. How much longer do they have to wait for medical services than we do in the United States? So in Sweden, they have a national healthcare goal of 90 days from referral to see a specialist. The time period for a third of those patients in Sweden actually exceeds the 90 days. And then in comparison, in the U.S., the average time between seeing your general practitioner or your family doctor and seeing a specialist is around 40 days. We also see this in emergency rooms. And again, the data out of Canada and England are even worse, but it just shows that these free healthcare systems do come with a cost of wait times. And so in Sweden, the average wait time in an emergency room is 4 hours. Now you take a busy metropolitan area in the United States like New York City, and the ER wait times are less. They're somewhere between 2 to 3 hours. So, and then the other thing is, the price of healthcare in Sweden is not only in taxes and wait time, but they do pay copays. Now, yes, granted, the copays are very minimal, but they still pay copays for doctor visits, medicine, and hospitalization. So it's not a true free system in in any shape or form. So what about college? Free college. We hear the comment, well, everybody should go to college. It should be free, and students shouldn't be racked with all this debt. Well, it turns out that college in Sweden isn't free either. The free part, again, the taxes. But the other part of the free part is that it only covers tuition. It doesn't cover room and board and items such as that. So many Swedish students actually accumulate about $20,000 in debt for their university degree. So they graduate with $20,000 in debt. Well, how does that compare to the United States? Well, for undergraduate school in the United States, on average, the average student accumulates around $26,900 in debt. For graduate students in private school, that average debt is around $32,000. So, again, the Swedish students, they're not only are their parents getting hammered in taxes to pay for the free stuff, but there is still debt that they are paying. And in Sweden, you would think, well, gosh, they've got free education. Everybody must have a college degree. But again, resources have to be allocated, whether it's going to be toward education or whatever. So they, like a lot of European countries, have entrance exams. As a matter of fact, in Sweden, they only go through what we would call 10th grade, and then they go on either to trade schools or some vocational school, or they go on to the university, depending on testing. And so what we find out is that in Sweden, despite their quote-unquote free education that comes with high taxes and debt, that the number of degreed individuals in Sweden is roughly 37% of the population, which is actually probably a little less than it is in the United States, or somewhere around that same amount. So anyway, when people tell you it's free, it's not free. And as we can tell with the beer, which beer would you rather be drinking? Well, I'd rather be drinking the porter. Forget the Miller Lite, but I would rather have a full glass of porter than just this amount of the porter. And so, they always say the Swedes are some of the happiest people in the world. Well, that might be true, but I know one thing: they don't have enough beer to drink. Hey, till next time in the garage, have a good weekend, and I'll talk to you later. Thanks.